Hi, welcome to my whole body approach series. My name is Sandra Van Gilder. I'm a physical therapist and I love trying to empower and teach people with knowledge because the more you know, the more you can do something about it to fix your problems. And I've been going over how the knee is connected to the rest of the body, how the ankle is connected to the rest of the body. And I've also gone over previous videos on kind of the front of your hips, like the hip flexor, the back of your hips with the hamstring, and a little bit of the glutes. Now today I'm gonna tackle your inner thighs. And I think that your inner thighs is one of the most misunderstood areas of your body, along with the glutes. So your glutes are, so if this is your tailbone right here, and then this is your pelvic bone, these are like small parts of your, and this is your hips are out here. So these are little, like your glutes have your small intrinsic glute muscles that basically layers your pelvic floor. And then you have these big muscles. And then you have these big side muscles here. And then your inner thighs are basically the front of your pelvis here. And it connects from the front of your pelvis to your leg bones, and it fans out. So I love to have these multiple visuals because it really helps me to understand what's going on. So these red areas are basically where your glutes are attached. So it basically wraps around. So this is your tailbone, right? So it wraps around to either side. And then they also then come down and they go into your leg bone. Okay, so it's a huge area. But the thing that I want you to understand the most though is the angulation of it. So you don't see it going straight up and down. It's actually fanned out. And your pelvis is round, so everything's kind of circular. So it doesn't really make sense when we only squat with our feet completely straight in one direction all the time. It actually makes more sense if we're able to move our feet in different directions so that we can stretch these muscles in multiple directions. And this is where what I teach from, it's not only a whole body approach, but it's also a three-dimensional approach because our bodies and our skeletal structure are three-dimensional. So when we don't angle things and we don't rotate, this is where we get in trouble because a lot of times we're taught to not rotate because of lower back pain or knee pain, but maybe it's because we're not rotating from the right places and we're not training the body how to rotate. So we teach people how to squat 27 different ways at least, and all different kind of variations, because when we move the position of our feet, we actually angle and stretch the glutes in different directions. So if you look at my stretchy pants here, if I do a squat, see how it has to lengthen? But when I do this, there's actually, try this yourself because it's probably hard to see on video, but when you lift up like this, you're gonna see wrinkles, you're gonna feel wrinkles in your pants, but when you stretch, it's lengthened. And when I always like to think that if you're in a suit that's way too tight and you try to squat, you're gonna rip at the seams. And so that's also how you may actually injure your lower back or other parts of your body, is that you don't have the flexibility for the joints and the muscles to move right, so then you're gonna pull and tug in the wrong places. So it's really important that we understand the mobility aspects of your hip muscles, your glutes. That works in concert with your hamstrings that attach here, your hip flexors that attach from the front, but also today I'm actually gonna talk about right now the inner thighs. The muscles attach from this pubic area, pubic ramus, this bony part is called, and it goes and attaches, fans into your inner thighs, like the picture that I showed you earlier. And when those muscles are too tight, it can pull, and literally, because this is just a cartilage in the middle, it can pull apart and cause a lot of pubic pain. this happens oftentimes, this can happen during pregnancy, because during pregnancy we have all these hormones, specifically a hormone called relaxin that loosens our ligaments so that the babies can pass through. But if we have, our muscles are not balanced and we're too tight, then it's gonna over pull it and it's gonna cause pain. So for today, what I'm gonna show you is an adductor inner thigh stretch. So like this. So I like to have my foot and my toes 90 degrees apart, and I'm gonna put all my weight on this leg. And all I'm doing is that this is just resting. I like to pretend that I'm like stepping on an egg. So I'm barely having, I'm just resting my weight on it, not putting any extra weight. My whole body weight is on this leg. And then I'm just shifting back and forth, okay? And I'm just trying to open up my hips here. And again, I'm calling this a stretch, but really it's a movement. It's a movement pattern that is gonna increase my hip mobility so that femur, that leg bone can rotate. And every time it rotates, it's gonna stretch those glute muscles, stretch those hip flexor muscles, rotate and stretch those hamstring muscles in the back, okay? So I'm just doing this back and forth. Now again, there are multiple ways to do this stretch. So I would encourage you to download my PDF to figure out how to do this stretch properly. And also, if you need a little bit more and you want to know how to apply these stretches in your everyday life in different locations, I've made a little video mini series to help you with that. So if you're interested in that, you can also comment and let me know, and there should be a link below for that. But what's so important though is that the balance aspect of it. So if you're doing those clams, where those thigh machines in the gym where you try to like make your inner thigh stronger by doing those things, or if you're trying to make those things where you're making your outer thigh muscle strong, just know that you're causing it to shorten. So you have to then do X, Y, and Z to balance it out, to lengthen it. If you have any questions, or you feel like maybe your hip tightness is impacting your knee pain or lower back pain, and you're in the San Diego area, check out G3 Physical Therapy, where that's our specialty, is that we're able to look at your whole body and figure out how maybe tight hips, tight ankles, tight upper back could be impacting your pain. So instead of just going to the symptom, we really try to look at the whole body and to find the root causes. I also have an online program. If you have any pelvic floor issues, or you just want your core to be strong, reach out and I'm happy to share more about this. So I hope this was helpful, and please comment below and let me know what else you would like to learn, and I'm happy to make whatever videos to help share this whole body approach.